Hi, my name is Becca Freeman, and we have Lauren Pagney and Christina Patelli, and our cohort that we have today is early adolescents. And one of the quotes that we use to talk a little bit about this age group is Mother Nature is providential. She gives us 12 years to develop a love for our children before turning them into teenagers. And I absolutely feel like that is a really good transition into the early adolescent field, because this cohort faces a lot of problems and is a really important group to counsel. So a little bit about early adolescents. They are from ages 13 to 18, typically late middle school through high school, and a bunch of developmental changes happen during this time. For physical development, you have puberty and changes in the body, and it's not just the same changes in everybody. It is gender specific about those physical development changes. You have cognitive development, and that's abstract thinking, hypotheticals, advanced processing of that information, social development, and a big one is relationship with peers versus your parents, as well as moral development and the self concept.
Early adolescents, they also tend to engage in risky or unhealthy behaviors. And you can see this when we talk about counseling issues with peer pressure, eating disorders, sexual behaviors, non-suicidal self-injury tendencies, and bullying. One of the counseling issues is peer acceptance and peer pressure. The presence of the peers actually has an influence on the brain. So one of the counseling issues you may deal with during this cohort is peer acceptance or peer pressure. At this age, they seek acceptance and approval from their peers, regardless if it has a positive or a negative effect. Stats show that more peer pressure has negative effects on adolescents, such as being antisocial or developing unhealthy or risky behaviors. There are some positive aspects, such as being influenced by someone who has a positive value, or they make positive choices and have positive behaviors. Another counseling issue, as we mentioned before, is your body image and eating disorders. Adolescents may be looking at their bodies and trying to figure out, if they're being socially acceptable for what their image looks like. So during this time, you'll see eating disorders, and during this cohort, they may become concerned with weight management in general. But there is some positive impacts on this, such as some of them want healthier lifestyles and eating healthier and exercising, where other ones may develop into eating disorders, which can affect their physical and mental health. Along with peer pressure and eating disorders, another one is bullying. And it's another issue that counselors may be dealing with. When adolescents are expressing aggression, it may be like their only outlet for stress. There's many factors that can contribute to bullying. And with technology developing, it also changes how students bully each other, which is where counselors may also have to be dealing with cyberbullying. So other things that counselors may be dealing with, because adolescents are naturally curious and they tend to engage in dangerous behaviors. Other issues that counselors may be dealing with are sexual behaviors, pregnancy, STDs or STIs, drinking or driving under the influence, drug use, smoking, and I'm sure that there's other ones that are pretty risky that they will tend to do. So when we talk about adolescence and theories, one of the theories that you may want to consider is Erik Erikson's stage of psychosocial development. Oh, that's a mouthful. So adolescents make significant life decisions when forming their identity by working out their crisis of identity versus role confusion. Often adolescents form their identities by exploring and experimenting with different types of identities. To critique this, though, marginalized groups are at a disadvantage because they don't have access to resources to fully develop. So with Erikson's theory, he believes in general that at younger ages, it will help them develop. And here, what we're saying here is that because they don't have access to that resource to develop to their full potential, it's a disadvantage. Another theory is with the ecological system. There are 5 levels that explain how each system interacts together. These systems are bullet pointed here on the slide. One thing to consider with adolescents is their social relationships and the world around them have the ability to either enhance or inhibit their growth and development. And here again, there's another critique. While this theory is culturally diverse, it does not look at biological factors such as genetics. And our last theory that we're going to kind of roll into today is the moral development theory. Adolescents may be conflicted with what peers do versus their moral values. And Kohlberg believed that moral reasoning is associated with ethical behavior and human development. And then again, like here, you can see the conventional stages is the stage for the adolescents. And this is where they're trying to figure out acceptance versus belonging, and then law and order and how that fits into their life. So with this, when you look at a critique, it is important to be mindful and sensitive to various faith-based practices.
I'm going to be covering a few important developmental domains of this age cohort, the social, emotional, cognitive, and moral developmental domains. The social emotional needs of this age cohort are made more complex by their fluctuating hormones experienced during puberty. During this time, there is increased sexual interest in rapidly maturing bodies. Members of this age group are strongly influenced by their peers, and their social lives take increasing importance during this phase. Friendships deepen, but peer pressure to engage in risky behaviors such as smoking, drinking, or drug use is very common. On the cognitive level, thinking becomes more abstract and symbolic during adolescence. Members of this age cohort start to think about the future and can become philosophical in nature. They are capable of more complex problem-solving skills and can find solutions to real-world problems. Morally, adolescents have become more nuanced in reasoning than earlier in childhood. They are influenced by their peers and family and culture in general, and start to develop a more spiritual aspect to their personalities. The developmental needs of this age group are that we're going to cover here in the slides are self-esteem and the need for structure and clear limits. Adolescents need opportunities that will allow them to express themselves freely and that will encourage them to develop an understanding of themselves, others, and their place in the world. As this age cohort develops, their focus on future goals can lead to positive self-esteem and self-concept by giving them a path, purpose, and direction. However, it is also a time where there might be a lot of pressure from parents about the paths they should take. Adolescents need to foster positive relationships with peers and adults alike for social development and identity, but also for mentorship as they look ahead to the future. Boundaries are really important in this age group as they start to explore things and experiment with alcohol and gain a little bit of more independence from parents. And they might be gaining more responsibility with finances. So to have structure and clear limits around those things as they gain that independence is something that's going to need to be learned at this age.
So some barriers of implementation for counseling this cohort. The first one is socioeconomic status. And the biggest reason for this is that at this age, they're not able to really control that situation. So SES can impact the availability of services. Lower income families may not be able to afford counseling. And with that being said, like there's also an increased risk of counseling issues, and we'll go into that a little bit on the next slide. Another barrier of implementation for this age group, since there is the peer versus adult relationship that is always at play. The resistance to authority is very impactful. And the one way to be able to overcome that barrier is the therapeutic relationship and how important that bond is between a counselor and the um, early adolescent age group. And that's because you need to be able to gain trust and show them that you're not just your average adult, and that, that peer versus adult relationship isn't necessarily as present. Some cultural considerations to be taken into account. Ethnicity, race, and religion can impact how counseling this group should take place. As we discussed with the theories that were chosen, there are a lot of cultural considerations with SES, religion, and race that can be taken into account on how these theories are presented. Socioeconomic status impacts many different aspects of development on this age group, and like I said, is out of the individual's control. Lower levels of SES have shown an increase in emotional and behavioral issues, depression, anxiety, substance abuse, and suicidal attempts, as well as aggression. And it's also important to note that SES doesn't just necessarily um, partake in the financial aspect, but as well as social standings. And last but not least, psychological maturity. Since this is an age where so many different aspects of a person is developing, psychological maturity will vary with each individual. So it is important to, as a counselor, to focus on that therapeutic bond and see where the individual is psychologically, and how the best way to impact that counseling relationship as well as a counseling session is. And that is it. Thank you so much.